Good to be with you all. We're in a very critical phase of our war against the coronavirus. It's vital that every American follows our guidelines on the 30 days to slow the spread. The sacrifices we make over the next 4 weeks will have countless American lives saved. We're going to save a lot of American lives, and we're in control of our own fate, very much so. Maintaining social distance, practicing vigorous hygiene, and staying at home are your most effective ways to win the war and to escape danger. While you're fighting this battle from home, we're working with the best scientists, doctors, and researchers anywhere in the world. We're racing to develop new ways to protect against the virus, as well as therapies, treatments, and ultimately a vaccine, and we're making a lot of progress. I think medically a lot of progress. At the same time, we're also racing to get relief to American workers and small businesses, as you know. I want to remind small business owners across America that the Paycheck Protection Program is launching tomorrow. Nearly $350 billion in loans will be available to small businesses, including sole proprietors. These loans are up to 100% forgivable as long as employers keep paying their workers. Got to take care of your workers. Furthermore, we want Social Security beneficiaries to know that if they are typically not required to file a tax return, they don't have to file one in order to receive the direct cash payments that will soon be distributed to American citizens. The Treasury will deposit the money directly into the bank accounts. And don't forget, I will always protect your Social Security, your Medicare, and your Medicaid. Today, my administration is also issuing new guidelines to protect elderly Americans who remain the most vulnerable. By now, nursing homes should have suspended the entry of all medically unnecessary personnel. Today, we're further recommending that all nursing home facilities assign the same staff to care for the same group of residents consistently to minimize any potential spread. And we're also urging facilities to designate separate areas for healthy and sick residents. And this is a practice that we probably will be recommending into the future long after the enemy is gone. We're now conducting well over 100,000 coronavirus tests per day. It's over 100,000 tests a day. And these are accurate tests, and they're moving rapidly, which is more than any other country in the world, both in terms of the raw number and also on a per capita basis, the most. The FDA has also authorized the first coronavirus antibody test developed by Cellex, a key step that will help identify people who have recovered and to understand their immune response and their immune system. Moments ago, I directed Secretary Azar and Acting Secretary Wolf to use any and all available authority under the Defense Production Act to ensure that domestic manufacturers have the supplies they need to produce ventilators for patients with severe cases. We have over 100,000 being built right now or soon to be started. We anticipate issuing more orders under the Defense Production Act in the very near future, in addition to the one that I've just signed against 3M for face masks. We just signed a element of the act against 3M. And hopefully they'll be able to do what they are supposed to do. FEMA continues to deliver resources to areas most affected by the virus, including New York. On top of the 3,000 beds we're already providing to the Javits Center, the Department of Defense is adding another 48 ICU beds. Governor Cuomo has asked that this facility go, and it's a big, beautiful facility, it be converted to a COVID hospital. And we hadn't done that yet. We hadn't thought in terms of doing that, but their real demand is for that. And we had meetings on it with the task force. We had meetings with the military. And I've decided to say, yes, I'm going to do that. And it's going to be staffed by the military and by the federal government. And based on the fact that I agreed to that, we had two other facilities that were likewise asking for it, and that would be in Louisiana and also in Dallas, and we'll be doing those. We spoke to the governor of Louisiana, spoke to the governor of Texas, and we've told them that we will be staffing those hospitals again above and beyond, but that's okay. We have to do that. In addition, the USNS Comfort is docked in New York to accept patients. That is a non-COVID. To date, FEMA has delivered more than 4 million N95 mask respirators. And think of that, 4 million. Don't forget, we're a secondary source. The states are doing it, and we're backing them up, but we've gotten 4 million N95 respirators, 1.8 million surgical masks, 460,000 face shields, 1.4 million gloves, and 4,400 ventilators just to the city and to the state of New York. And some of them now are being sent. I spoke with both Governor Cuomo and Mayor de Blasio a little while ago, and some of them are being sent to the city. All of America stands with the people of New York in this time of need. It's definitely a hot spot, but we have other hot spots also, and we're taking care of them very, very strongly, very powerfully. We have the finest people in the world in those locations, and I think the federal government has not only acted early, but acted quickly, professionally. There's no people like this. Doctors, nurses, first responders, and other healthcare providers who want to help New York at this critical time should visit website nyc.gov/help-now. nyc.gov/help-now. New York City needs it. Louisiana, by the way, needs it. Michigan needs it. Whatever you can do, those are very strong hotspots. They need help. In recent weeks, as the virus has spread and economic hardship has followed, we have seen Americans unite with incredible selflessness and compassion. As citizens, we're linked together by the shared bonds of national love, loyalty, and affection. There's no earthly force more powerful than the patriotic pride that stirs in our hearts, and that is so true. It's incredible the job that everybody's been doing, everybody.